that access to my courses? That did you get that link and did you go through?
Yes, ma'am.
Okay. I want you to complete that course by next week sometime.
Sure, ma'am. Ma'am,
Okay.
I really wanted to say one thing when I told you like I'm rating myself around 4 out of 5. But
Mm,
now I want to, after hearing the all the healthcare videos
mm.
from your coaching, I want to rate myself 2, ma'am, 2 to 2.8.
That private coaching videos, yes. I mean, there is a lot of information that I cannot put on YouTube. That's why we have private coaching, right? Because YouTube is very restricted to the content that you want to, like, you
Though
cannot.
I have the contact from my previous organizations also, but that was not really this deep.
Mm. So that's why we have this paid courses, right? Because you cannot teach everything on YouTube. You're very restricted on the content, and whereas if you're private coaching, you tell everything. You tell everything to your students, so that they're well aware. You know what? That batch, everybody got hired.
Oh, very nice, ma'am.
Yeah, that batch, right? So there was one candidate who had multiple offers. So the one candidate who keeps on telling that. Asking me questions like he don't know how to answer and all, like he is from sales background and all, you see, right? One candidate, so he got three offer actually.
Mhm.
And then he picked up one, so that's, I said, he's from completely sales background. And I'm glad I was able to train him, and we went multiple mock interviews. I don't know how many mock interviews, and he attended more than 100 interviews, but finally he got like three offers, and he's working. So it takes effort, a lot of effort from the candidate side also. It's not
Ma'am,
only
is
from
this
the.
like did he join like he's based on India?
Yeah, he's from India. He's from a non-IT background. He was from sales, and he had no IT experience, but right now he's in IT. He's working in IT.
Ma'am, I have like few doubts. Like just on Thursday and Wednesday, I have got you know attended SP Softwares and CGI.
Mm,
So they asked me few questions based on US healthcare that I didn't got a chance to answer.
mm,
I didn't gotten information also, though I have asked my seniors and all those things. So the first question is how many addresses a patient has.
mm,
And I told him based on my experiences, home
mm,
address and office address. He
mm.
asked me, can we send, the the medical information or diagnosis results, so and so to the office? And I said, yes, if he want to keep secret, from the family, I don't know, just tell me because I, so then he said like, no, we have home address and he said like remittance address or something. I just forgot what
Yeah,
exactly.
remittance primary address and remittance address. Yeah,
And
so.
he said another third one also. He said we have three, but he
Mm,
said like at the last he said, sorry, I forgot the last one, and he told me. So
mm.
that's okay. I thought.
Then what's the other question they asked you?
It's for SP softwares. He
Mm-hmm.
said like HMO, PPO, POS. I told him
Mm,
we have like POS, right? Then it's a flexible plan. Then why
mm,
we do have like PPO?
mm.
It is also like most flexible plan, and then also we do have independent plan also, right?
POS. So he asked about difference between all these plans and why we have so many plans. That was a
And
question.
PPO in the highest, there is no pay, like highest patient responsibility. Like, the network will be high, the premium will be high.
Okay, then what did he say?
No, they didn't answer this one. I also got confused. And one more thing, ma'am, I think Medicare is primary and Medicaid is the last resort, right?
Medicaid. What did you say? Medicaid is?
Primary.
Okay. And then?
Medicaid is the last resort. I mean, you will be Medicaid will be the paid. First, primary will be the Medicaid. Then after the private insurance. Then after Medicaid, right?
No, you just Medicare or Medicaid, you're telling.
Medicare
Mm.
is
So
the
you
first
said,
resort to pay.
okay, Medicaid is primary. Then you say they're going private insurance is going to pay, right? That's what you're
Yeah,
saying?
next one. Yeah. And the
Okay.
third one will be the Medicaid.
Third one is again Medicaid, you're saying?
Medicaid. First one will be the Medicare. First one is CARE. Last one is CAID.
So yeah, that's what I'm asking. So you're saying this is Medicare.
Yes.
Then Medicare is primary. Then you say private insurance, and then you said Medicaid is the tertiary insurance, right?
Yeah, last one. That's what the sequence, right?
No.
Or
Okay.
private insurance is first, then Medicare or Medicaid.
No, I'll give you
I got
scenarios.
confused actually in this.
Okay, so like what is the scenario he gave you?
No, they asked me what will be the first who will be paying the first and all those things, and I said it's Medicare. I got confused.
Mm,
Medicare. I said Medicare will pay the first.
okay. Yeah, I will explain you with the scenario. Then what are the other questions?
Other questions I asked subscriber, member ID,
Mm,
and this one there will be a contract between payer and provider, and what will be the provider payments like per day, per
mm.
admission, all those things he asked.
Okay, so why did he ask you that? What was the scenario?
Oh no, he's just asked me what is the just an abbreviation types. He asked co-pay, co-insurance, deductibles,
What
just
is
like that.
copy?
He
Okay.
didn't give me any kind of
Mm,
scenario. He just asked me basics of US healthcare.
okay. Co-pay, co-insurance and all that. Okay. I think I've covered these topics in that private videos. So go through it. But like when it
Okay.
comes to this primary and the secondary address, right? So we need to like there is something called opt-in. Okay.
Mhm.
So opt-in in the sense if the member has opted in, so the default is a primary address.
Home address.
Yes, the default is the primary. If the member has not opted in, like for example, I have two address. One is in Georgia, one is in Florida. Okay, so for my primary address is in Georgia, whereas I go to my Florida residence on occasional basis or during um, winter. I go there. That's it. Maybe that's my beach house. I want to go there. You have two addresses. If member does not opt in, I don't opt in. Okay, so I'm not saying which is my preferred address. Then in that case, that is always primary address. Will be the um, home address. I mean, the very my first residence, right? That will be Georgia. Will be my primary address. But if I have opted in, saying that do not send it to my primary address, send all
Mhm.
my EOB bills, like everything, my letters, my authorization, like my appeal letters, everything. Okay, send it to the secondary address. Only then if the member has to opt in and opt out, so you need to know what is opt in opt out.
Okay. So what is exactly the remittance address? Is it office address or somewhere else?
It can be any
Or
address. It can be his friend's address. It can be address. So remittance address is the address like where they want all the bills, letters to be sent. It need not be a home address. It can be office. It can be friend's house. It can be cousin's house. It can be anything.
and
It's not.
opting
It's not
and
a
opting.
residential address. Okay, so it
Okay.
can be a house. It's a possibility, but it can be office. It can be what do you call it? It can be any your friend's house. You don't want the bills to come to your house, right? So that is remittance address.
Mhm. And he asked me one more question also, ma'am. Like what he said, like if a member ID has a prefix or suffix,
Mm,
what it means. Then I said, like, bro, BCBS has these kind of prefixes.
mm.
But he said no, that's not the answer. And I asked him, then he didn't reply.
So so you need to know. So for example, see here the prefix always mean the first letter always means that which state and plan. So for example, you have something like images like VA, it's not XYZ, you won't get it. So for example, here you get it as New Jersey. NJX means it's a state, that particular state they belong to. This is their ID. Okay, this is their member ID.
Mhm.
Whereas NJ represents the state. Let's take another example.
That's what I told him, ma'am. It will be for Blue Cross Blue Shield, and we do have like home plan and state plans.
No, don't say it for see any card, any card, right? Not only for a Blue Cross Blue Shield, any insurance card. If you have it as Amy for Texas. There are not some real ID cards. They have replaced, right? So you are going to have your state and plan details only. But you can also process it without the prefix. It's not that prefix is mandatory. Your actual member ID is not with the prefix. So for example, you take it, right. So this is K6000. This K is for Kentucky. So like 600, that will be your actual member ID. So that K is representing the plan and the state. So in a particular state, for example, Georgia, Texas. So every even if it's commercial insurance, so BCBS is commercial, right? So even if it's commercial, and you're going to give them allocate like space specific member IDs, then only you add prefix.
Okay.
So I mean, what did he say for that?
He didn't answer.
He didn't say. Maybe he's checking. Yeah, there is no like I wouldn't like worry about this and all, right? Because see here,
I even
when
asked whether the answer which I said is right or wrong. He didn't even say that. So
okay,
as far as I remember, Blue Cross Blue Shield actually has a prefixes.
right. Not only Blue Cross, many other um, insurances also have it, but prefixes mean like we always know that it is always with the state and the plan. So that's how we have. And we have, like, for example, you go to Medicare, Medicaid. So for commercial, you'll have it. For Medicare, Medicaid, we don't endorse prefixes. So that's the difference. So for commercial member IDs, for Blue Cross Blue Shield, you may have it, but for Medicare, you may not have it. For Medicaid, you may not. You'll be having only that 10-digit number, right? So it depends upon, sometimes commercial can have it, but GBD, right? The GBD is government-based division, they may not have it. It is very unique to the insurance company. Okay, next one. You want to know about this different plans. What was the question you said? Why PPO versus?
We have HM. She asked me to explain HMO, PPO, POS. I said
Mm,
everything. Then and indemnity plans also. Then
mm-hmm.
she asked like PPO, HMO is okay because we have a very limited access. POS and PPO, like POS is a flexible one and PPO is also. Then why we need to have another one? Because we already had POS, which is more than flexible than HMO.
So he's asking why POS.
PPO.
So I mean, I am not getting a question. So he asked you difference between three, right?
Yes, I
PPO is a.
answered them.
Mm-hmm.
I answered them. Then she asked me, we already have POS, right? HMO is very limited.
Mm,
POS is flexible.
mm.
And another one we have PPO. If we have POS, right, it's where it is already flexible, then why we are choosing PPO?
Okay, it's because of networking. So let me open.
Then I answered her, like it's more flexible than POS. The patient responsibility is also high. The network is.
Let me show. So yes, I mean PO, difference between POS and PPO. That's what if she's going to compare and like determine which one is a good choice.
Yes,
Um,
she's not asking the choice. She's asking already POS is there.
mm.
Then why we are choosing PPU? POS is also we don't need any PCP referrals and PPO also for, we don't need referrals. For here also like patient responsibility is high, network is also high, premium is also high. Then why we are keeping PPO again? And why
So
also
see here that the see if you have an issue where you don't want referral at all, but here you need
Mhm.
referral, right? For everything you need referral.
Yes.
You have to understand that without the primary BCP doctor's referral, you cannot See, even though this is like most affordable and all that, the premium is less, you have out of network coverage and all that, that's fine, but you still need referrals from the PCP.
Yes.
Okay, so you cannot see a specialist without the PCP's concern or without PCP referral. But let's say that you have chronic kidney disease and you every single time you don't want to go and get the referral, not pay. And also referral, don't you think like in US getting a referral is one of the most headache actually. Like everything, like if you want to go to dermatologist you need referral, you want to go to a cardiologist you need referral, you want to go to every single thing outside for a specialist, you need referral. You cannot go without a referral. But in PPO, you have that freedom.
Mhm.
Okay, so I need not even connect with my PCP at all. I just go to the PCP for yearly once. I get the checkup, and if he says that, yeah, everything looks good. Do you have any other issues? Yeah, I have concerns with my cholesterol. I think I need to check with the cardiologist. Okay, fine, you check it. That's it. And you need not be every single time like calling them nurse, and you're going to like it depends upon the health situation. If you are a normal human being, you don't have any kind of issue, then of course you go with POS, right? But if you really have heart disease, you have chronic disease, you get my point. If you have those kind of like severe health issues, if you have cancer, like severe like issues, every you cannot wait for the PCP, right? Because PCP is not going to send you the referral like in one single day.
Yes.
It's going to take some time, at least a week. Even if you were like you're going to escalate it, you're going to expedite the request to the nurse, it's going to take a couple of days. And if you're having like chronic health issues and you want to see a lot of specialists, and we have candidates like that, we have people like that who have multiple health issues, all these immune problems, who cannot wait even for a single day. Otherwise they have to go to the ER, then they get
Okay.
admitted. So, and if you get admitted, see, when you don't get the referral from the PCP, I'll tell you what happens. You cannot see a specialist. And if you don't see a specialist, they won't give you appointment, right? So you have to go to the emergency room. And if you go to the emergency room, they're going to ask you to like do everything and then ask you to admit and all, which is way higher expensive than the premium for PPO.
Okay.
So if you are someone who are having like major health concerns and you think like you need you need frequent visits to the specialist, not with the PCP, with the specialist, then you have to go for PPO.
Mhm.
Mm. So, for example, like here they've given example, right? You are having fertility trouble. You want to go to IVF treatments, IUI, IVF treatments. That treatment every month you have to go. So you cannot wait for the PCP to give you a referral for every single session.
Yes.
Mm. So even though the premium is like little bit high, we know that it is high, but the freedom is there. So you're not dependent on the PCP. Got it?
Mhm. Yeah.
Yeah, that's the difference between POS and PPO.
Got it, ma'am.
Okay, and then what's the next question? So you want to know the who will pay first, right? Like, let me take
Yes.
you an example for that. So first of all, this is the scenario, right? Who pays first? So, mm, so first is Medicare,
Mm.
and then Medicaid, and then only you get private. So first GBD division first. GBD is government based. Okay, so first Medicare, then Medicaid, then only private.
Okay, ma'am. And my personal questions. If we have Medicare, Medicaid, third party, and auto insurance.
Auto means it's not healthcare. What do you mean by auto insurance? Do you know what is auto insurance? Auto insurance is for car.
Okay. Accidents, right?
No, health insurance is different from auto insurance. What is the terminology you're talking?
In US healthcare itself, we have like auto insurance, ma'am. Like one of my examples has been given as per my, previous organizations is when a specific person, taking, traveling to the same kind of an company car or van or something like that by taking the goods related to the company. So it will, she told me like it will falls into auto insurance where US healthcare comes into the picture and all those things.
Yeah, so see, it means like what I mean, yes, I mean it we got it like for example, we have something called Geico. Geico is the auto insurance, okay. I'll show them their website, then you so you have Geico here, right? So you have Geico. Geico is nothing but it's an auto insurance. Okay. So they don't provide health insurances. What they do is like, for example, I have a car, I have a new car. I have to get the insurance, right? That's mandatory in the US. Otherwise, if there is any accident, you have to pay out of pocket. If you're rich enough, you can do it. But everybody, most 95% of the people who have car needs to take this auto insurance. Or if I have a home, I'm having a brand new home and I have to take insurance because anything can happen to the home. If I don't have insurance, everything will go out of my pocket. If I have the insurance, if something like flood, something like disaster happens, the insurance is going to cover some part of it. So Geico is not a health insurance. Okay, it is auto, means they cover like all this mobile, boat, business, rental, like buildings, our house and cars. Okay, when you get an auto, let's say that you get an auto insurance from Geico and you travel in the car, and then without knowing you suddenly hit someone. Okay, hit
Mm,
someone means then what you are telling is that Geico will cover some of the part of the other person's health insurance, right? Or
mm. Yes, ma'am.
mm. But see, they don't own it. You have to understand it. That again goes to the health insurance company only.
Mm-hmm.
Okay, so it depends upon the plan. For example, if you say that I don't want those kind of, let's say like I'm taking an auto insurance, and if you start the quote. Okay, it's going to ask all my details. Let's say that you have taken only a basic coverage. Okay, you're not taking something fancy, you're taking something like very basic. Then they are not going to cover all your insurance, nothing. They're not going to do that. What they will do is like they will cover some part of, like for example, your total car is crashed. So they're going to like give back some part of it. And since you've taken like a very basic policy, that's what they will do. They'll say that according to your policy, these are only like $20,000 is covered. So we will not like take care of your health and all that and all is out of, because you didn't, that's not covered in the policy. So they will reject, or if even if you submit. Whereas you've taken like full blown like premium policy where the car is covered, your health insurance is covered, and then they have that the third party, like for example, someone, the person that you went and crashed, right? Theirs is
Yes.
also covered. So you have
Mm,
like
yes.
a premium like policy that you have taken. Only in that case, they're going to cover for your car, and they are going to cover your healthcare expenses. So, and then they are also going to cover for the third party expenses too, right? So how they cover is like you will go to the hospital, you will get admitted, and the billing, no, that part of it, yes, Geico will cover it. Yes.
Yeah, ma'am.
Yeah,
And
but
in that case, the first will be paying auto insurance, right?
yes. So in that case, when it comes to health insurance, or so your insurance, right, your health insurance, right, they will not be coming as first, but we need to have like additional like all this proof and everything. Okay, this was an accident. This is by so you like Geico have take precedence. This will take precedence over your health insurance. Yes, correct. When it's an
Yeah.
accident, yes.
Yes, yes. Ma'am, one more thing, the last question from my side. Like, what if we have like workers' compensation? So the first will be paying worker compensation, then Medicaid, then after third party, right? Right?
Correct, correct. So always workman compensation comes first. Correct.
Yes. Yeah, that's it, ma'am.
Okay. So I think, so how did you answer all the questions? So did you take yesterday? When was the interview?
One was on Wednesday, one was on Thursday.
Okay. So how did it go?
Unfortunately,
Mm,
healthcare part was good, ma'am, but coming to, this Agile Jira, this went wrong, so I got rejected.
okay. So what are the questions they asked you in Jira?
Like, have you worked upon Jira?
Mm,
Have you worked upon Agile,
mm,
Power BI, SQL, and all those things?
okay. So do you know how to create user stories in Jira?
No, ma'am, I didn't really worked upon Jira actually.
You have not worked. So this is a Jira tool. Okay. We have a 30-day trial period, I think. So you can actually like get access using your Gmail account. So you can
Mm-hmm.
download this Jira. So once you get download into Jira, so you can create a project, and then you should be able to come to this screen. Okay.
Mhm.
So this is the screen that you'll be having where you click on create.
Mhm.
In clicking on, when you click on create, there are like 4 issue types. So in Agile, we always say it as issue types.
Okay.
Issue types. So issue types, what are the 4 issue types? You have epic, then you have story, then you have bug or defect, then you have task. These are the 4 issue types. We say it as issue types. Okay. So you will not create uh, a story all the time. It's different. So what you will do is, depending upon whenever you gather requirements, let's say that um, since you what is a project that you want to add? Give me an example of a project.
We will take enrollment, active, passive, and ongoing enrollments.
So let's say that enrollment. Okay, enrollment. If you want to, you're working for an enrollment IT team. Okay, let's say an example. So in that case, we have like a new vendors where they're going to send like maybe hundreds of members. So you want to make sure they're all enrolled, and now that is a project, right? Which is going to be maybe taking like 2 to 3 months. Now for
Yes.
that, you're going to create an epic. Epic is nothing but high level requirements. High
Okay.
level.
So the example I will be giving it, ma'am. So have high level requirements. We will be having a 5 kind of insurance, and it should be reflected on the plan source application, right? Is this a high level requirement?
No, I would say, like, for example, enrollment means like you're going to do automation of enrollment. Okay.
Mhm.
Automation of enrollment for, let's say, like, what is the market? Let's say these people are from uh, California. So for
Okay.
California, that's all. Just on a high level for this one project, you're saying that the project name, let's say epic is nothing but like a solid project name. You're not going below than that. You're not, because you're what why we are creating epic is we are going to track the user stories and defects, bugs under that epic.
Okay.
So epic is just like naming. That's all. Naming convention. Like name, you just give a name for the project.
Mhm.
But all your requirements should be as stories only.
Mhm.
So this is just like if they ask you what is a project that you worked on, you can say that, yeah, I worked for the enrollment project for California market. There was a brand new project that took along like 3 months. So that's the name of the project, right? That will be the epic.
Okay.
That's all. So then every single requirement will be a story or a task.
Mm-hmm.
Okay, so difference between story or task is like, for example, when it takes more than 8 hours for you to do something, then that is a
Okay.
story.
Okay.
But when it takes less than 8 hours, then that is a task.
Are we, breaking the stories into tasks?
Yeah, if it takes more than 8 hours, you will break it, or
Mm.
you can increase the story points also.
Mm-hmm.
So, for example, let's say that for enrollment, right? If you want to automate that enrollment and you're creating that task, first what you will do? You have to create the BRD, right?
Yes.
Let's say that your creation of BRD. Creation of BRD. Okay. So how long it's going to take? You're thinking to create the BRD?
Based upon the how many requirements we have and
Hmm.
the availability of stakeholders and those things. So I will be taking maximum of 1 month.
1 month. So
Yeah.
do you know, like, so 1 month means, let's calculate the story points for this. So every week, how many hours you are working? 40 hours, right?
Yes.
And so for a month, how many hours are you working? Approximately into 4 weeks.
Yes.
So that will be 160 hours.
Mm-hmm.
So one story point is one, if I say one story point, that is 8 hours. So for
Okay.
160, like how many story points? If I say one story point, it means 8 hours, right?
Yes.
Yeah. So like for then you tell me from story points, but if I want to utilize 160 hours, then how many story points it is?
Like 1280 kind of.
You divide it by 8 and tell me.
Uh, 20.
20 points, right? So what is like one story point is like 8 hours, right? So how much is 20 story points into 8? So 160.
Yeah.
Okay. So these story points, this you take you it will take like 20 story points for you to write the BRD,
Mm-hmm.
right? You cannot make it as 20 story points. Like I've told you, story points are always Fibonacci series. 1 pointer, 2 pointers, 3 pointers, 5 pointers, 8 pointers, 13 pointers. This is how you can rate it. So now you like divide that maybe into so 20 story points. Like how do you divide them? Maybe 8 and 13. So at least that's fine. 1 point is extra. That's totally fine.
Oh, ma'am, I'm a bit confused here.
See here, story points, right? When you create a story, should always be in like whether I'll be able to complete in 8 hours, in 16 hours, like because one story is 8 hours.
Okay.
So if this BRD can be completed in one day, yes or no?
No,
No. Whether so it can be like in 16 hours, in like maybe in 2 days,
not really possible.
3 days,
No, as
fi-
we mentioned, like it will take 1 month means yeah, at least it will take like 20 if
20
in one
days.
yeah,
Hmm. So
20 days.
20 days, right? So,
Yes, yeah.
but I cannot give 20 story points here. That is a very big story for you because our sprint can be 2 week sprint, 4 week sprint. We don't know.
Okay,
So what we will do, so usually in our project, right, we don't give like too many points on a story. We break down this, maybe part one, part two, something like that.
okay.
So if you create a user story, we don't want to go more than 13 days. So what you
Oh,
do is maybe
to
part one.
complete
Mm.
no, for 13 days is to complete entire BRD or to complete only the first or two, three, four parts.
You have to tell me, you are the BA. So if you say like to create a BRD, it is going to take 20 days.
Yes.
I don't, so as a product owner, I'm like, no, I don't want to give 20 points on the story. So we can do maximum 13. We don't want to overwhelm you. You can carry forward maybe in the next sprint. So you divide that into two user stories. That's all.
Okay.
And then how many points you'll give? If I say this is part one, let's say I'm making this as part one. Okay. And you said it will take 1 month. That's what you
Mm-hmm.
told, 1 month. So for the very
Yeah,
first 2 weeks, um, you can use this story. Like how many points you're going to give for 2 weeks means 14 points.
14 points. Yeah.
So maybe you can give it as 13 because there is no 14 point. It's Fibonacci series. You give 13. That's it. Then you duplicate this. So maybe you can clone this or you can create another user story. So I can create another user story. Part two, that's for I'm creating part two. Now for the remaining, right? 13 points are there. So remaining maybe if you feel that you can finish it in another 2 weeks, a 13 pointer is going to come. Or I can also make it as 8 pointer if you feel you can finish it maybe in next 2 or 3. We don't know exactly. It will take a month, it can be extra, but you can always create user stories. Why am I telling you is because when we create user stories as a BA, you have to like think about how long this is going to take. Okay, accordingly, the number of user stories will increase. If it's going
Okay.
to take on, yeah, if let's say like you're creating a mapping document, or you're drawing something, a UML yeah, a data flow diagram. So you're drawing one diagram, data flow diagram.
Mm-hmm.
That is the requirement. So they want you to draw the data flow diagram. How long
Mm-hmm.
is this going to take for you?
3, 4 days
3, 4 days to draw the diagram. So from a point perspective, like how many points you'll give if it's 4 days?
or 10.
No, I've told you story points will come in Fibonacci series. Now you have to tell me 4 days means how many points? See, 1 day is 1 point.
Yes.
2 days means 2 points. 3 days means
Yeah.
3 points. So if you say four,
Yeah,
it should
4 days
come
it's
for
4.
4 points, but
4.
we cannot give four. It's Fibonacci series, right? So we cannot give four. Either you have to give three or you need to give five.
Okay, not exactly.
Yeah. So maybe you don't know whether you don't know exact data flow. You want to schedule calls with the stakeholders. You have to get requirements. Only then you can complete the diagram. So you'll go for
Yeah.
5.
Yeah. Ma'am,
Anyway.
I have a doubt here.
Mm,
So when I said like it will be like 20 days, and he given me 13 days or 15 days, okay. So
mm,
what happens is when I'm conducting the requirement gathering, the persons who are giving the requirements for another requirements, like for every requirements, if suppose we think we have a different stakeholders, but for the second, third, fourth, fifth requirements, the people are same.
mm,
So what we thought is like we after second day requirement, we still have like 20 to 30 minutes of time. Okay.
mm,
So what I told them is why we should waste time. Let's discuss the as we have completed the second day requirement. Can we discuss and give take the requirements of third, fourth, fifth day?
mm.
Okay, and we took that.
Okay.
Then here the time will be saved, right, ma'am?
Yeah, time will be saved. So see, it depends upon sprint, right? For example, let's say that your team is
Is
having.
I'm asking, is this possible?
Yeah, it's totally possible. See, this is an estimate. Nobody's asking you to give exact hours and all.
Okay, I thought here we're gonna give an exact thing.
No,
Okay,
no,
it was
nobody.
actually happened with me. So that in
So
where I
see,
was conducting that.
I mean, it's good if it's less time, but usually it takes more time. Okay, if you are able to finish within that, whatever like points you're giving, whatever hours you're like expecting, estimated, it's good if you're able to finish the. That's why we are following agile, right? Because we are estimating a task, we are estimating this much time we are going to do, we are going to finish that task in that particular time. If everything goes on well, we complete it. If not, because that can be thousand reasons that you are not able to do this on within this 5 days. You're saying you need to draw data flow diagram within 5 days. There can be multiple reasons that you cannot finish within 5 days. For example, maybe you got sick, you got that the stakeholder is sick. We never know.
Yes, yes,
And
yes,
they can be holiday, it can
yes.
be anything can pop up, so we never know. This is just we during backlog grooming we are giving points. And the
Mhm.
whole project perspective is we are we are planning to finish this in this particular days, but if you cannot finish it, then the story gets postponed to the next sprint.
Mhm.
And of course
And
you will get
sprint is
escalated, that's there, but still it will get postponed.
escalated to who?
Manager.
Okay. But
Yes.
what if it's a mistake from, client itself? He told like we can carry forward to next sprint. What if he doesn't really, and by following up also he doesn't give the requirement? This things also happens, or
No, we can,
sometimes.
as a BA, we cannot. We conflict with stakeholders. How do you handle negative stakeholders? This is where like you're going to have conflict with stakeholders. See, now you are well prepared. You're going to the requirement gathering session, and they don't show up. You're sending multiple emails. They don't show up. They just
Follow-ups.
ignore. So, but then you gave 5 story points, and then you're unable to finish this particular thing, particular story in that, but because you have multiple external factors. We understand that this is the typical like for you a challenge as a BA, right? Because you are not done
Yeah.
anything wrong, but there are some external factors that is affecting your story completion.
Yes, ma'am. So I have this one of the answers which I have learned from my previous organization, ma'am. So when we are conducting, requirement gathering sessions, when we got to have a first call with the stakeholders and everybody who are involving giving the requirements, we need to ask if you in your absence, who the person I should contact with to get
Mm,
the requirements done on time.
correct.
So this was what I have learned from my previous organization.
Yeah, you need to plan really well and
Yeah.
coordinate with them, constantly communicate. That's why it's very important to have effective communication. Okay,
Yeah.
you send them emails, they might not even read the emails, or they just can ignore it. So you send them emails, you ping them, you create a
No,
chat.
ma'am, like we should ask them on the first meeting itself. We should not really, postpone this kind of question to after 5 to 6 meetings. We should, my lead told me we need to ask this question on the first day after getting the, project approval meeting or in the, project charter meeting itself. We should
Yeah,
not
so
really
we will
postpone.
always have a backup for every candidate, right? Like every
Yes, yes,
stakeholder, we will have a backup. That's for sure.
yes, yes.
But in reality, right, sometimes both won't respond. In reality,
Yes,
like
ma'am.
it's
This
very
really
hard.
happened with me in Thanksgiving and Christmas time. It was a really kind of a headache.
Yeah, during holidays they just vanish, and then you're and then you're like stuck with your story, and then nobody is there. Then your manager is like, why didn't you complete, right? So
Yeah.
practically we have a lot of hurdles and challenges as a BA. See, story point estimation is very crucial. If you think it's the stakeholders can be very complex characters, if you think it's going to take a lot of time, please give that extra point.
Mm-hmm.
So you saying that I'm just saving time, you are just throwing the mud on yourself,
Mm-hmm.
because you saving time means like they have to be also like attending meetings, giving you requirements, coordinate with you.
Yes, yes.
So I wouldn't like do that. If even if let's say I create a task, mapping document task, so you know that it can be completed within 8 hours, I'll give 2 points, 2 days.
Mm-hmm.
So we never know, anything can happen, your kid can fall down, you're being called by the school, you can get fever, and anything can happen, we never know. So always like give that extra bit of that 1 point extra, to make sure that you're able, otherwise they are going to ask you why you didn't complete on time.
Okay.
Mm. So story point estimation, this is like called as estimation, right? Yes. We calculate by Fibonacci series. One story point is 8 hours. We get it. But in actual, like in practically, when you're doing it, you have a lot of challenges to finish that particular task or stories on time or within that particular sprint. So when you estimate the go live and all, when you get requirements for the very first call, when you're like all the stakeholders are there, and when you ask them when you want to go live, and then they give you a date. For example, today is the first call with the stakeholders, and you ask like, okay, what is expected go live, and they say maybe February 1st. You immediately say no,
Mm-hmm.
it's not possible for me to gather requirements and then start development and testing and go live on February 1st. It's totally not possible,
Mm-hmm.
right? Unless it's like a mandate or something, where
Okay.
other all the other projects needs to be dropped, and only this we need to focus. So leadership,
Mm-hmm.
for example, leadership is saying that no, we have like a government rule, like all the other things has to be stopped. This is what you have to focus on. This just one project. Until you get that signal from the leadership, you're not going to pick up that particular story.
Okay.
So whenever, as a BA, whenever you're going to gather requirement, the very first thing you're going to say them, we have a standard process in our IT team. Okay, for requirement gathering, it takes 2 sprints. For documenting, it takes 2 sprints. Then development, it takes like 2 sprints. For testing, it takes 2 sprints. Maybe we can go live only on April 1st.
Okay.
So you need to know how long for your application, how long it will take. That will come only by experience.
Okay. Ma'am, here the sprint is 2 weeks or 2 months. Or it is depends upon, the BA or Scrum Master or the developer.
It's not a depend on you, it depends upon your project manager. So
Okay.
so the sprint is fixed, you're not changing sprint every month. Okay, so it can, if your team thinks it is 2 week, then every 2 weeks it's new sprint, means
Okay.
project manager.
So we can adjust, like a project manager decides like in how many sprints we can, do the things.
See, no, see, you have to get the point here. When you go into a project, right, it's
Mm.
already it's established whether that team is like 2 week sprint team or 3 week sprint team or 4 week sprint team. You cannot change that.
Okay, got it, ma'am.
Okay, so that's something that project owner decides. For all of my teams, it's going to be like 4 week sprint or 2 week sprint, whatever it is. So that is not changing. That's a constant thing. That is decided by the project manager. You have to accommodate to that change and say that, for example, you have this automation like for this enrollment, that particular project is there, and it will take maybe 3 months, and you
Mm.
have every month is a new sprint. According to your
Mm.
manager, like every 4 weeks there is a new sprint. So how many sprint is going to take for going live?
Like three.
3 sprints. Yes, that's how you're going to tell to the your stakeholders. It will take 3 sprints. So one sprint for gathering requirements, one sprint for development, one sprint for UAT, and after 3 sprints we will go live. Like that, you have to tell.
Okay, ma'am. Ma'am, one more thing I have a doubt. If I have joined in a very new company and I was a new BA there, junior BA, senior BA, or anything. So if I got assigned to a new project, right? First thing, what they're gonna give me, is it a project charter? Like if they anything XYZ project and I want to take the requirements.
Yeah, they should able to give you all the documents for about that project charter, and then existing BRDs, whatever. If you have any senior BAs, what is the process for that particular application? So they should be able to give you some details on that project.
Okay. And one more thing, ma'am, like if and every project and every company, follows different kind of rules, right? Like when we are preparing the BRD, not every company has the same set of rules.
Not even every team.
Yeah, that's what. Yeah.
So
Yes.
inside the same company, every team is going to follow their own process. So we cannot say,
Yes.
we cannot generalize at all.
Yeah. Okay, ma'am. Got it.
Okay. So when you learn about Jira, so what you want to learn is like, okay, there are like four issue types that I
Mm-hmm.
have to do. So I have to create a story, I have to create a task, I have to create a bug, like defects in UAT or in QA region or even production defects, right? Anything. And an epic. Epic is like I have told you, that's like
Title.
that's a title. Yeah, that's it. Under that epic, all your user stories, bugs, and tasks will come.
Okay.
So when like someone stakeholders, right, they need not go for every story number. They go to this epic. You share this epic number to your stakeholders, and you say that all our team works will be tracked under that epic. Please follow the status there.
Okay. Ma'am, I have a doubt here.
Mhm.
When you said bug, I don't have any kind of experience into manual testing or automation.
Mm.
So how the BA, involvement will be there in that?
So during SIT, right? So you know what are the different types of testing? Unit testing, SIT testing, UAT.
I only know UAT and I have done UAT. Is it important to know manual testing, like at least the basics?
Yes, you need to know. Yes. So SIT is system integration testing. That when you are testing with other systems, but you are one application, but in order for that overall project, you're testing with other systems. So that is SIT. UAT is the user acceptance, where the testing will be done by the business owners. So for SIT, usually there will be testers like internal QA testers will be there, manual testers, automation testers, some kind of testers will be there.
Mhm.
But sometimes due to budget constraint, testers are not there. If they ask you in the interview, have you tested, you just say yes, yeah, I know testing, I know how to create test plans, test scenarios, and I have done SIT. Let me give you an example. um, so let's say that for this enrollment project, right? So how do you test? I have four members whose details has to be like loaded into that enrollment system. So in that case, how do you test that functionality?
So we will be having a login.
Mm.
So we will be having a login ID and password, like correct login ID and correct password. Correct login ID, wrong password, wrong login ID and right password, wrong login ID and wrong password.
No,
And then,
I'm asking about, you're talking about enrollment team, right? So let's say that I'll give you a real-time example. Let's say that four people are joining CTS. Okay. Four
Mhm.
members are joining CTS, and
Mm.
now CTS is giving them Cigna insurance.
Okay.
So these four members' details has to be loaded into Cigna, right?
Yes, Signa
Okay.
application. Yes.
Enrollment application, right?
Yes.
So what will do, these four members' details, CTS HR will be sending it to the
Signa.
agent.
Okay.
There will be an agent. So
Mm-hmm.
HR will be sending to the agent. Agent will process it as EDI 834 file.
Okay.
Okay. So in EDI 834 file, it will be having first name, last name, address, preference, everything,
Mm.
dependency information for active date, like today they have enrolled. All this information will come from that agent
Okay.
as a file, EDI batch processing file. Okay.
Mm-hmm.
So that file will be will come to through the SFTP setup. Okay. FTP protocol, right? SFTP protocol. Do you know what is that?
No, ma'am.
Okay, I'll teach you about that. Through SFTP setup, that file will be dropped into our Signal location.
Mhm.
So if Signal location means it's a particular folder, enrollment folder path, where this IT enrollment IT team now has to process that file, right? It's an EDI file. Okay, they have to process that file, make sure that file is loaded into the database. I mean, file information in that file.
Okay.
Okay, so now what are the informations? For example, member first name, last
Last
name,
SSN
dependence
number.
name, yeah, everything. Okay,
Yes.
address, everything needs to be loaded in the system. So now how do you test this functionality? So what will you do as the BA? How do you test this?
By writing test cases.
Yeah, I mean, like I'm asking so for what you will do, you will take 4 members, right?
Mm-hmm.
You will take 4 members. You will ask the vendor, like for example, that agent. You will, if we have that vendor, you will send the member details to the vendor. Ask them to send a sample EDI 834 file in the QA region, not in production, in the testing region, right? So there will be a testing SFTP location, the test folder. They have to like drop those files, and our developers will make sure that those files are being processed and loaded into our QA region, SIT region.
Okay. Okay.
And then we need to make sure that you'll check and you'll query the database and you'll check whether those 4 member information are loaded into our QA region.
Okay. Querying in the sense we are using SQL here.
Yes, we'll query the our testing environment.
Okay.
And what is the result needs to pop up? All the 4 test members details needs to be in our testing region, right?
Mm-hmm.
Database, right?
Yes. Yes.
That's how you do end-to-end testing. I
Yes,
mean
ma'am.
SIT. So if you're going to do it in UAT, what will you do? Again, you will create 5 dummy members, give it to
Yes.
the vendors, ask them to create the EDI file, the 834 file, drop in the UAT region, and then we'll make sure that is opened and processed and loaded into our UAT environment where business owners have to now log in and check whether the all the members, like 5 members, information are in the UAT region. That's how you do end-to-end testing.
Yeah. Oh my God, I need to learn a lot, ma'am.
Yeah. So you have to explain the scenario to the interviewer. If they ask you what are the testing, you have to give by case scenario and explain to them.
Mm-hmm.
Explain like this. This is what I did. Okay, for this scenario, these are the test plans I did. So how do you make sure it's a valid test case? So for example, one of the member information is missing. First name, last name is missing. Will we process it? No, we will reject that file.
Yeah.
So if member like member's address is missing, it depends. When we get requirements, we have to tell to the agent. These are the mandatory fields. If we miss
Uh-huh.
one of the mandatory fields, we'll reject that file.
Okay. So then it will be a typing mistake from their end, right? Like,
Yeah, it could be many errors. It can
yes.
be a system error. It
And
could be.
the folder path is created. Everything will be separate, right, ma'am? For Cigna or we do have it's just my doubt.
Yes,
So
yes,
it.
yeah.
Okay.
Yeah, it will be separate. And for SFTP, right, that's a different IT team. So you have to coordinate with that team and create all this folder path and everything.
Okay.
So real projects will be like this.
Yeah.
You got it? So we
It,
when
it,
we
it's interesting, ma'am. Actually, it's very interesting, and it's being scaring also a little bit because I have
no,
never done this kind of thing.
yeah, when you said enrollment, that's why I took this scenario.
Okay.
You only told, right? You want to talk
But
about
I
enrollment.
never really died in this deep, ma'am, actually.
Yeah, this is the expertise that they are expecting, right? So you have to explain like this. Then they're going to ask you what is EADI 834, explain in detail what are the mandatory fields, what is a file format, what is
Hmm.
SFTP setup, how do you query in the data, like in the back end, tell me the scenarios, explain SQL. These are the questions it's going to come.
Hmm.
Okay, so we need to learn a lot, but I'm just giving you an example. If this is the use case, accordingly, you will be developing your user
Okay.
stories, multiple user stories.
Okay.
So creation of EDI 34, you give requirements to the agents, you talk with the SFTP team, create the location path folders, that's a story. Then when you receive the file, we need to make sure that it's processed and loaded in the database. That's a story. You have multiple user stories to be created.
Mm-hmm.
So just to finish this, it is going to take at least 2 months to
Oh my
finish the
God.
yeah 2 months for this one case scenario, right? To finish the UAT and get the sign off, it's going to take 2 months because you're dealing with an external vendor.
Yes.
Mm.
If he doesn't available on time, then it will even take more time, right? Because
That's
he's
all.
a
If doesn't you send email and he doesn't respond, then that's it. Like escalate to your
because he's a
manager.
vendor, we can't even say anything to him.
Correct. And then you're going to escalate to your manager saying that I responded, but I didn't get any email. Can you please escalate to their manager? Okay. So what we will do, Lakshmi, is in next class. So it will take some time for you to process. I want you to finish all those videos, and then in the next class, I will teach you in detail how to create user story. So for this is one case scenario, right? In that, like how to create user stories, how to create task for the scenario, and then how to
Yes,
write
ma'am.
acceptance criteria, everything in detail for this use case.
Yes, ma'am.
Okay. Sounds good. Okay, I have to drop. I have to join another call.
Sure, ma'am. But
Okay.
thank you. Thank you so much, ma'am.
Yeah, thank you. Bye. I'll see you in the next class.
Bye, ma'am. Have a
Bye.
nice day.
Bye. You too.